Welcome to our webcast presentation for PSEG Medicare eligible retirees and/or Medicare eligible dependents. We're here to talk to you about an important change to your healthcare benefits. Thank you for attending this session to learn more. By now, most of you have reviewed the brochure shown on the screen. Starting January 1st, 2021, PSEG is introducing a new and enhanced way to deliver retiree healthcare benefits for Medicare-eligible retirees and dependents. This new approach gives you and your Medicare-eligible dependents access to a private Medicare marketplace where you can choose medical, prescription drug, and dental coverage. You'll have access to individual healthcare policies through VIA Benefits, the country's largest Medicare marketplace. PSEG is going to continue to provide financial support to those retirees whose benefits are currently subsidized today. To help you pay for your coverage, PSEG will make a contribution to a Health Reimbursement Arrangement, or HRA, which you can use to cover healthcare premiums and certain out-of-pocket costs. We'll go into the HRA in more detail shortly. To help you through the transition and ongoing, VIA Benefits advisors will be there every step of the way. They'll help you choose a plan that makes sense for you, and they will continue to provide ongoing advocacy and support throughout the year. Please note that this change does not affect retirees and dependents who are under age 65 and not Medicare eligible. Those not eligible for Medicare will continue to be covered under PSEG's group plans. So what does this mean? To sum it up, you have more choice and flexibility when it comes to your healthcare. Through VIA Benefits, you'll have a wider choice of healthcare plans with many lower cost options that have comparable or even better coverage than your current plan through PSEG. The marketplace includes a range of options at different price points and insurance companies. Vision coverage is also available. It offers greater flexibility because you and your eligible Medicare-eligible dependent can elect separate plans. Next, you continue to receive financial support from PSEG through the HRA if you're currently subsidized today. You can use the HRA to reimburse yourself for premiums and out-of-pocket costs. And any amounts you don't use roll over to the following year. And finally, you receive expert support and advocacy from licensed benefit advisors. They're here to help you compare your options, enroll, and ensure a smooth transition. Let's dive deeper into the Health Reimbursement Arrangement, otherwise called the HRA. Starting January 1st, 2021, PSEG is making an annual contribution to the HRA when you enroll through VIA Benefits, if you're currently subsidized today. The contribution amount depends on whether you retired before or after 1994. You receive a medical HRA contribution if you enroll in medical, and a dental contribution if you enroll in dental through VIA Benefits. Your Medicare-eligible spouse also receives an HRA contribution if they enroll. You can see how it adds up on the screen. Plus, every year, these contribution amounts will increase by 1.5%. Following are some key details about the HRA. First, to receive an HRA contribution, you must be eligible and enrolled in a medical or dental plan through VIA Benefits. The HRA is a tax-free, non-interest-bearing account. You can use the HRA to reimburse yourself for healthcare premiums or out-of-pocket expenses, such as deductibles and co-payments. For those who have a non-Medicare eligible spouse on a PSEG group plan, You can even use your HRA to cover their healthcare expenses, as long as they are a legal dependent living in your household. If you have a Medicare-eligible spouse, you'll have a joint account. Any unused funds roll over to the next plan year, as long as you remain eligible. If the PSEG retiree dies, any unused HRA funds can be used by their spouse to pay for their healthcare premiums and out-of-pocket expenses. Ongoing funding from PSEG will stop upon the retiree's death. The annual HRA contribution will increase each year by 1.5%. And finally, the HRA is funded by PSEG only. You cannot contribute to the account. Let's review some key dates and what you need to do. If you haven't already done so, call Via Benefits to schedule your enrollment appointment. Benefit advisors are here to guide you through your options and help you enroll. October 1st through December 31st is the enrollment period to enroll through Via Benefits. One key change with the move to Via Benefits is that you will no longer be able to have premiums come out of your pension check. You'll have to pay the healthcare insurance company directly and then get reimbursed through the HRA. We'll review this process in more detail further in the presentation. Starting December 1st, you'll be able to submit for reimbursement for your HRA. Retirees and dependents under the age of 65 and not Medicare eligible, covered under PSEG group plans, will continue to see pension deductions for their premiums. Finally, the Via Benefits plans are effective starting January 1st. Coverage under PSEG plans ends on December 31st for Medicare-eligible retirees and dependents. Now we'll discuss what happens if you choose not to enroll by December 31st. Regarding medical and prescription drugs, you may have a gap in coverage and only have access to Medicare Parts A and B. You also may not have prescription drug coverage. For dental, you may be subject to pre-existing clauses when you try to enroll in coverage in the future. And if you don't enroll, any Medicare-eligible dependents will not be able to access HRA funds. You, the retiree, must be enrolled through Via Benefits for Medicare-eligible dependents to have access to HRA funds. Your non-Medicare eligible dependents will not be eligible for coverage under the PSEG plans. We encourage you to call Via Benefits today so you have the coverage you need starting January 1st. Now I'll talk about Via Benefits and explain the transition from the PSEG plans to individual plans. My name is Bill Tisdale, and I'm a meeting ambassador for Via Benefits, a part of Willis Towers Watson. As you continue to view this presentation, I hope that you find what I share to be informative and helpful as you consider changes in your healthcare coverage. First on our agenda, I'll talk about who we at Via Benefits are and explain the transition from your current PSEG healthcare plan to individual Medicare plans that you choose through Via Benefits. I'll explain the basics of Medicare, the types of plan options that you'll have, and how those options can work for you. We'll talk about the Via Benefits enrollment process and what you can expect when the time comes for you to enroll. We'll introduce you to your Health Reimbursement Arrangement, or HRA account, and how you can use that to help pay for your medical expenses. For our final topic, we'll go over the steps that you may need to take within the coming months. With that, let's get started. Hundreds of employers of all sizes, both public and private, including many of the largest companies in the world, have trusted Via Benefits to help their retirees when it comes to Medicare. Via Benefits is the first and largest private company to offer this service. Over the last 15 years, Via Benefits has helped over 2 million people transition to individual Medicare health insurance. And we've completed these transitions with continuously high customer satisfaction. We're not an insurance company, we're an insurance marketplace. We offer plans from over 120 national and regional insurance companies, which gives you a wide variety of choice. So you can find a plan that meets your individual healthcare needs and budget. Via Benefits is available to you online 24 hours a day, 7 days a week, or on the phone Monday through Friday from 8 o'clock in the morning until 9 o'clock in the evening Eastern Time. We have an online help and support center with hundreds of articles on how to use our tools and services, as well as information about Medicare. During our business hours of 8 a.m. until 9 p.m. Eastern Time, we're available to help you. When you call our toll-free number, you'll reach one of our 3 service centers in Utah, Arizona, or Texas. All of our benefit advisors are based in the United States. They're trained to help you choose and enroll in health insurance and to act as your health insurance advocate going forward. Not only are the calls to our service center advisors toll-free, but there are no fees for the advice or services that they offer. Via Benefits offers all types of individual Medicare plans. That includes Medicare Advantage plans, sometimes known as Medicare Part C, Medicare Supplement insurance policies, also known as Medigap plans, and Part D prescription drug plans. I'll go into further details about each of these in a moment. In order to find insurance coverage that fits your individual needs, it's important to us that you have different plans to choose from. So we work with over 120 national and regional insurance companies. Some of their logos are on the screen now. Whether you recognize the insurance company or not, Via Benefits is diligent in only allowing plans on our platform that meet high industry standards. Dental and vision plans are also available. Medicare Advantage plans are offered by private insurance companies who have contracted with Medicare to provide plans that are designed to be as good as or better than original Medicare. Medicare Advantage plans provide all-in-one plan coverage, which bundle hospital and medical coverage and, most of the time, include prescription drug benefits too. They also can provide other benefits that aren't covered by original Medicare, like dental or vision coverage and even gym memberships. The monthly premiums you pay can be quite low, even $0. But there are out-of-pocket costs, such as co-pays, co-insurance, and possibly deductibles associated with the plan. So the more care that you need, the more you'll pay. Conversely, the less care you need, the less you'll pay. So these plans can save you a lot of money when you're healthy. And Medicare Advantage plans place a lot of emphasis on preventive care. Medicare Advantage plans are network-based plans. This means that they each have a network of doctors and facilities that will accept the plan. The 2 main types of Medicare Advantage networks are the HMO and PPO types. HMO stands for Health Maintenance Organization, PPO stands for Preferred Provider Organization. An HMO has a narrow network. Your coverage comes from doctors who are in that network. If you need to see a specialist, you probably will need a referral from your primary care physician, and the specialist will also be in the network. PPO plans have a wider network. They will allow you to get care from a healthcare provider who is outside of the network. In general, you'll pay a lower cost for coverage if you go to a preferred provider who is in the network than you would if you went to a provider who was outside of the network. Some Medicare Advantage plans offer something known as optional supplemental benefits. These benefits are added to the Medicare Advantage plan, which you can purchase for an additional cost. Not all plans offer these benefits. We'll talk about details later. Medicare Advantage plans are always guaranteed issue, which means that they won't ask about your pre-existing medical conditions, and you can't be denied coverage if you're over the age of 65. The other option is to enroll in a Medicare Supplement insurance policy or Medigap plan. These Medigap plans work with Original Medicare to fill in the gaps of Original Medicare coverage. Medigap plans don't bundle coverage, so you'll need a separate prescription plan to cover your drugs. While this means that you'll be dealing with two plans and possibly two insurance companies, it also means that you have the freedom to choose separately the medical and drug plans that each fit your personal healthcare needs. Standard Medigap plans have no network restrictions, which means that you can see any doctor or go to any facility in the United States that accepts patients with Original Medicare. There are a few Medigap plans that are labeled Select plans. Select Medigap plans may have a defined network. The premiums for Medigap plans are usually higher than Medicare Advantage plans, but you pay lower out-of-pocket costs, if anything, once you start to use your plan. If you choose a Medigap plan, you may be asked to pay the first month's premium at the time of enrollment. Medigap plans have simple single-letter names in most states, like Medigap Plan G or Medigap Plan K. There are up to 10 different standardized Medigap plans that offer varying levels of coverage. For example, a Medigap Plan G is considered an exceptionally comprehensive plan. After you pay the monthly premium and the Part B deductible, the Plan G will pay for 100% of the remainder of your Part A and Part B medical costs for the rest of the year. Due to recent Medicare changes, two of the options, Plans C and F, will no longer be offered to those who first become eligible for Medicare in the year 2020 or later. Medigap plans will be offered through different insurance companies, but the plan will work the same regardless of which company you select. That is, a Plan L from one insurance company will cover Medicare the same way as a Plan L from another insurance company. The difference in Medigap plans from one insurance company to another is the cost of the premium, as they each set their own premium price for their Medigap plans. So a bargain price does not mean less coverage. Let's take a few moments to discuss Medicare prescription drug plans. All Medicare prescription drug plans, whether they are standalone Part D plans or bundled into a Medicare Advantage plan, have the same basic structure, but they can vary widely in which drugs they cover and what they charge for those drugs. That makes choosing a prescription drug plan a very personal choice, because most people take a different set of drugs than someone else. Prescription drug plans start with a formulary. Formulary is the name for the list of drugs that a plan will cover. Each plan can have a different formulary list, and each formulary will divide their prescription drugs into separate tiers. The cost that you pay will be determined by the insurance company and the tier level they have assigned for your prescriptions. We usually see 5 tiers in a plan's prescription drug formulary. Tier 1 drugs will be the less expensive preferred generic drugs. Tier 2 is usually called non-preferred generic. Tier 3 is for preferred brand name drugs, and Tier 4 is for non-preferred brand name drugs. The prices usually increase as the tier levels increase. Tier 5 is called specialty drugs, for drugs that are very expensive. Medicare separates prescription drug coverage into 4 coverage levels that you can potentially reach during any given year. First comes the deductible level, which can range anywhere from $0 up to $445. Then comes the second level, which is called the initial coverage level. In this level, you'll pay a set copay depending on the tier level that the medication has been assigned to by the insurance company. This is very similar to most other prescription plans. If the full cost of the drugs that you purchase during the year reaches $4,130, then you move to the third level called the coverage gap, or the donut hole. This happens to about 1 in 4 of Medicare enrollees. If you reach this level, you'll pay a percentage of the retail cost of the drugs. 25% for both brand name and generic drugs. Most of those who enter the coverage gap level will remain there for the rest of the year. But your insurance company is required to keep track of one more thing called your true out-of-pocket cost. The true out-of-pocket cost is a combination of what you have spent on your drugs from the first of the year and manufacturer discounts while you were in the coverage gap. If that combined total reaches $6,550, then you'll transition to the fourth level called catastrophic coverage. In this final level, you'll pay a minimum copay of $9.20 for brand name drugs and $3.70 for generics, or 5% of the cost of your prescription, whichever is greater. About 4% of Medicare enrollees reach this level. This is an annual cycle, and each January the process begins again at the first level. If all of this leaves you scratching your head, you're not alone. Since most people take a different set of drugs than someone else, your experience with these levels can be quite different from other Medicare enrollees. Fortunately, when you enter your prescription drugs into your personal profile, our search tools can simplify all of this for you. In fact, I think that the most important thing that you need to remember about Medicare drug coverage is this. Our search tools will easily be able to tell you how these coverage levels will apply to you and give you an annual cost estimate for any prescription plan available to you, so you can make a confident and informed decision about your new drug coverage. PSEG will reimburse all out-of-pocket prescription drug expenses once the catastrophic level of coverage has been reached for those eligible for a health reimbursement account. You must submit proof that the Part D catastrophic level has been reached. You can use the monthly statement from your insurance company. More information about this benefit will be included in your VIA Benefits Guide to Reimbursement. Our next topic is the VIA Benefits enrollment process. Please enjoy this short video to meet the people in our call center who may help you as you prepare, review, and enroll in individual Medicare coverage.
Hi, I'm Brian from Salt Lake City, Utah. I'm an operations service manager.
Hi, my name is Jim Lapota. I'm a benefit advisor.
Hi, my name is Camila Jackson. I am a customer service supervisor.
Well, hello, my name's Dale Williams, and I'm a licensed benefit advisor here at Willis Towers Watson.
During this uncertain time, my work is more important now than ever.
Job number one for me is to support and advocate for my customers. Always has been, always will be.
Whether they're calling in to check on a reimbursement request or they need help choosing a new insurance plan, my goal is to make sure by the end of the conversation that they're smiling. And trust me, I've done this for a few years. I can tell when somebody is smiling over the phone.
In fact, it's my favorite thing about my job here, making the health insurance process easy and making new friends at the same time.
We're here for you outside of business hours too.
Our website is available 24 hours a day, 7 days a week.
If you need help with our online tools or resources, I'm your girl.
We know it's a scary time for everyone, especially if you're a little bit older.
Just know that even though many of us are working from home,
we are still here, able and willing to help you in every way possible.
We truly put our customers first, and that is the most important thing to me.
VIA Benefits helps you enroll in health insurance through an efficient and proven three-step process. Your time is valuable. Go online and take these steps in order to maximize your time. This is the overview. We'll go into more details in the next few slides. The first step is to prepare. Gather your information, your current doctors, your prescription drugs, and your Medicare card to create a VIA Benefits account. And if you choose, you can set up a call to speak with one of our benefit advisors. Next, review. Use our Shop and Compare and other decision support tools to understand your options based on the specific requirements entered in your VIA Benefits account. And then enroll. Enroll online. It's fast, secure, and easy. Included in your PSEG announcement package in early August was a booklet called the Getting Started Guide. This booklet will help you get started for your upcoming enrollment by providing you with the information you'll need to prepare for the enrollment process. You can save time by going online to set up your profile prior to your enrollment call. Once you've read all of the materials from PSEG and the Getting Started Guide, you should go online, create an account, and set up your personal profile. Prepare to enroll by gathering your information and creating a VIA Benefits account. We ask you to create an account and add your information so our decision support tools can show you plans which meet your specific needs. When you create an account, we'll ask for your personal information. This includes details such as your name, email address, home address, and telephone number. Please note, we never sell or distribute your personal information. If you provide us with an email address, we will send you communications via email, like newsletters and other Medicare-related information. You can easily opt out of emails as well. Entering your prescription drugs into your profile will help our search tool find the prescription drug plans which cover the drugs that you're currently taking. Make sure that you gather the name, dosage, and frequency of the drugs you currently take to enter the information into your profile. We'll also ask for your Medicare ID number and the effective dates for Medicare Parts A and B. Essential doctors are the ones that you currently see. If you're interested in Medicare Advantage plans which have a network, we want to ensure that your doctors are in that network. The final preparation is optional. You can schedule an appointment with a benefit advisor during open enrollment. Once you complete your online profile, you can set up an appointment with a benefit advisor online or over the phone by calling 1-866-202-9678. Our benefit advisors are licensed and certified in plans across the United States. An appointment is recommended because your time is valuable and we want to pair you with someone who is knowledgeable about the plans available in your area. Setting up an appointment allows you time to go through our website and shop for plans, or go to Help and Support and learn a little more about Medicare. In any case, we will have someone available for you on the date and time of your appointment. If you prefer, you can review plans and enroll online. The VIA Benefits Enrollment Guide contains information about Medicare, how it works, an overview of your plan choices, and how to review your plan options and enroll online. You should receive your enrollment guide by the end of September or early October. It will also contain the phone number to call and the web address. That number is 1-866-202-9678, and the website is at my.viabenefits.com/PSEG. This guide does not contain detailed plan options and information. You can view that information online by visiting our website at my.viabenefits.com/PSEG in early October, or call 1-866-202-9678 to speak with a benefit advisor to receive 2021 rates and benefits. Shop and Compare allows you to view Medicare Advantage, Medigap, prescription drug, and dental plans available in your area and sort them by price, plan type, insurance company, and other factors. With just a few clicks, you can compare plans side by side and review the details of plans that interest you. If you're looking for Medicare Advantage plans, those plans have networks. If you choose to create an account, you will also be able to enter your preferred doctors in the My Doctors section and your current prescription drugs. This will help select medical plans like Medicare Advantage plans that include your physicians and the Part D prescription drug plans, which include the prescriptions you take. Earlier, we spoke about optional supplemental benefits, which some Medicare Advantage plans include. If you're shopping for Medicare Advantage plans, The results will clearly display when a plan offers optional supplemental benefits like dental, vision, and hearing aids. You can click on the link to see more details about the benefits offered. Another tool on the website is the Help Me Choose tool. This tool will ask you questions about your needs and recommends the types of plans that might fit those needs. You can then compare actual plan details on the website. If you entered your physicians in the My Doctor section and the prescription drugs you're currently taking, you'll be able to see the plans which your doctors accept and the Part D plans which cover your prescription drugs. One of the best things about the website is that it operates 24/7 for your convenience. That address again is my.viabenefits.com/PSEG. When you search for plans, if you haven't entered your current prescription or your prescriptions have changed, you're able to enter or update the prescriptions in your personal profile, which will then compare the coverage of those drugs between the plans available to you. Once you've made the decision on which plan or plans you want, choose Add to Cart. Your shopping cart and the plan or plans you selected are displayed. Select Start Checkout near the bottom of the page. The Steps to Checkout page appears. Enrollment for most plans can be completed online. Each plan indicates whether a call is required to complete your application, or if you can complete your enrollment online. During the checkout process, you'll be prompted to schedule an appointment to complete your enrollment if necessary. Follow the steps to checkout and enroll in the plans, or call 1-866-202-9678 to speak with a benefit advisor, and we're happy to assist you. 7 to 10 days after your enrollment, you'll receive a mailing from Via Benefits called the Selection Confirmation Letter. This letter will list the plans that you've enrolled in. This letter cannot be used as proof of payment or as proof of insurance. You will receive the full plan details in separate mailings from the insurance company. When you receive this document, please review it to make sure that you understand the information. And if you have any questions, please give us a call. We are here to help you throughout the year, not just during open enrollment. We have a help and support page where you can find the answers to most of your questions, which are always available to you 24/7. If you have questions about your plan, you can contact Via Benefits during our business hours. And if you need us next year, we're still here to assist you year-round. When you create an online account, you have the convenience to shop for, compare, and enroll in a new plan. It's important to keep your profile up to date. For example, if you started taking a new drug, add it to your profile. So when open enrollment comes, you can compare plans based on the prescriptions that you currently take. It's time to talk about the Health Reimbursement Arrangement, or HRA. The HRA is a tax-free account established by PSEG to reimburse you for eligible healthcare expenses. As part of its IRS definition, you must pay first and then you'll be reimbursed. You must be enrolled in a medical and/or dental plan to receive HRA funding. Funds will be available starting December 1st, 2020. You may use those funds to reimburse yourself for premiums on your medical, prescription, dental, and vision plans, and for out-of-pocket costs on other eligible expenses. Any unused funds at the end of the year will roll over to the next year. Here's how the reimbursement works in 3 easy steps. PSEG will allocate benefit dollars to each eligible retiree's HRA arrangement. You'll then work through Via Benefits to enroll in your individual coverage. First, you make the premium payment to your insurance company. Second, notification comes to us at Via Benefits that you want to be reimbursed for that payment. That notification can come from you or from the insurance company, depending on which reimbursement option you select. Third, Via Benefits processes your request and checks to make sure that you have the proper funding amount available in your HRA account, and then deposits it directly into your designated bank account. Maximize your account. Sign in, set up, and automate. Improve, streamline, and automate your reimbursement experience. Signing into your Via Benefits online account is a secure way to request and manage your reimbursements. Set up direct deposit. This is the fastest, safest, and most secure way to receive your funds directly to your bank account. You can sign up for this feature online. Automate your premium reimbursement. You can turn on automatic premium reimbursement from your online account if it's available for your plan. Automatic premium reimbursement enables you to be reimbursed for your premium payments without submitting a monthly reimbursement request. Via Benefits offers this feature for most insurance policies. Go paperless. Reduce the amount of paper mail you receive from us by registering for electronic statement delivery and notifications online. From this same web address, you can also check your current funding balance and see the status of reimbursement requests and related transactions like electronic deposits. Automating processes and using these steps improves security and increases reimbursement speed. Plan on an additional 10 days if you print and mail or fax a reimbursement request. For your added convenience, there's an app that you can download to your smartphone or tablet to manage your reimbursement arrangement. The easy-to-use Via Benefits Accounts mobile app is integrated with the website and intuitively designed so you can manage your HRA quickly. With the mobile app, you can check reimbursement status, check available balance, submit new reimbursement requests, take a picture and attach documents to your reimbursement requests, all from your smartphone or tablet. The mobile app is available for iOS and Android. Let's drill down into how our automated features work, such as direct deposit and automatic premium reimbursement. Automation is the most secure method to be reimbursed. Automatic premiums reimbursement is convenient. Once you set it up, the reimbursement is automatically returned to you on a monthly basis through direct deposit. This type of reimbursement can be used for premiums on the plans that you enroll in through Via Benefits. Over 90% of the plans sold through Via Benefits support this feature. When you choose automatic reimbursement, each time that you pay your premium to the insurance company, they will send Via Benefits notification of your payment. We will then send your reimbursement to you through the mail or deposit it directly into your designated account, whichever way you prefer. With automatic reimbursement, you do no paperwork at all. To receive your reimbursements in a fast, secure way, set up direct deposit. All you need to do is provide your bank information for where you want the reimbursement to be sent and use the online form. It's safe, secure, and easy. You should be aware that while automatic reimbursement is convenient, it's not immediate. It does take time for the insurance company to notify us of your payment. You should receive your reimbursement within 6 weeks or less from the time you made your payment. Most reimbursements should come around the same time each month. If your plan isn't available for automatic premium reimbursement, you can submit for your premium to be a recurring reimbursement, meaning you'll be reimbursed for the same amount every month. If you can be reimbursed for out-of-pocket costs, this is the same process. The only difference is you submit for out-of-pocket expenses as you incur them. Those are not available for automation. Again, to improve this process, be sure to set up direct deposit. Direct deposit is the most secure method to be reimbursed. You must be eligible and enrolled in a medical and/or dental plan to receive HRA funding. All necessary instructions on how to use your HRA will be provided in your reimbursement packet, which should arrive at the end of November. This is a very important fact about your HRA. In order to continue to receive funds in your HRA, you need to enroll in a medical and/or dental plan through Via Benefits before your enrollment period ends on December 31st, 2020, to have access to your HRA. And you must remain enrolled in a medical and/or dental plan through Via Benefits each year to continue to have access to your HRA fund. Via Benefits offers additional healthcare benefits. Via Benefits offers other non-Medicare benefits available in your area. Options include accident insurance, life insurance, hearing aid plans, senior critical illness insurance, hospital indemnity insurance, and short-term medical insurance. Ask your benefit advisor if you're interested in any of these additional benefits. We're just about finished. I just need to call attention to a couple of important items. The next step to take is to prepare. Gather your information and create a Via Benefits account. Add details such as your current prescription drugs and doctors so our decision support tools can show you the options which meet your specific needs. When you create an account, we ask for your personal information. This includes details such as your name, email address, home address, and telephone number. Again, we never sell or distribute your personal information. If you provide us with an email address, we will send you communications via email, like newsletters and other Medicare-related information. You can easily opt out of these emails as well. Entering your prescription drugs into your profile will help our search tool find the prescription drug plans which cover the drugs that you're currently taking. We ask for your Medicare ID number and the effective dates for Medicare Parts A and B. Essential doctors are the ones that you currently see. If you're interested in Medicare Advantage plans which have a network, we want to ensure that your doctors are in the network. After you create your Via Benefits account, if you choose to do so, please set an appointment with a benefit advisor during open enrollment to discuss your plan options and answer any questions that you may have. Once you create your online account and enroll in a plan, you'll be able to manage your HRA from that same account. From your account, you can set up direct deposit and automatic premium reimbursement. In conclusion, I'd like to thank you for taking the time to view this presentation. I went over a lot of material, and you likely have many questions. If so, please feel free to call us at 1-866-202-9678 Monday through Friday from 8 o'clock in the morning until 9 o'clock in the evening Eastern Time. Or visit the website at my.viabenefits.com/PSEG. We look forward to working with you soon. On behalf of PSEG and Via Benefits, thanks again for watching and have a great day.